This just came to my mind. Let's say, all right, you know how you have your heart, and then as blood leaves the left ventricle, it goes through the aortic valve into the aorta, right? Here, actually, let's do this over. Let's do this in black. So as blood leaves the left ventricle, it goes through the, remember, it goes through the aortic valve, and then it gets into the aorta. And then you have your aortic arch. We've got your 3 branches. Okay. Now, let's talk about your aortic problems. So let's say you have an aortic dissection. You could have an aortic dissection. You could have, well, first you'd have an aneurysm. Then you'd have a dissection. Then you have a rupture. What's the difference? Actually, let's write that a little better like a line. So this is kind of the continuum. You have an aneurysm. You have a dissection. And then you have a rupture. Which is which? What's an aortic aneurysm? So they're all problems with the aorta, but what's the aneurysm?
Like an occlusion almost.
So the aneurysm is where you have this kind of bulging out of the aorta. Okay. And the problem with this, especially if it gets greater than, so if we have a diameter here greater than 5 centimeters, that requires surgery. Okay. And the reason for it is as it gets bigger, as this bulge keeps getting bigger and bigger and bigger, it's likely to dissect or rupture. So the aneurysm is this kind of bulging out. And the reason that's a problem is blood kind of, let's put some old blood over here. You can have old blood that just kind of accumulates in this pocket and forms a clot. And if you form a big clot, remember the aorta is the largest artery. So now it can prevent blood from coming through this aorta. Okay. So that's an aneurysm. Now, what's a dissection? A dissection is where, so how many layers of the
3.
artery do you have? 3. Okay. What are the, oh, Lucian, you should know this. I remember you answered this question. What are the layers? Okay, so blood should be inside in what's called the lumen. Okay, so the blood is inside in the area called the lumen. The lumen is just the word for hole. This is the lumen. Okay, but what is this first layer called?
I'm thinking endo, myo, and then there's a third.
That's layers of the heart. We're talking about layers of the artery.
You know, I specifically remember you talking about it, and I'm drawing a blank.
Okay, so the innermost layer or the most intimate layer is the tunica intima. Okay, then we have the tunica, what's this one? Well, this. What's this layer called?
I know one's the tunica maxima, I'm pretty sure, but it's not that one.
Not maxima. Okay, so this is the tunica media. Here, let's put it in red. This is the tunica media. And then on the outside, we have the tunica externa. What's a dissection? It's where you get a tear in the tunica intima. Okay, an aortic dissection is where you have a tear in the tunica intima, and then this is what happens. The blood that was inside the lumen now starts leaking out, and now it goes between the other layers. That's an aortic dissection. Okay, what's the rupture? Here's your aorta, and we get a big hole in it. And now all this blood under high pressure that was inside here, it just leaks out everywhere and it spills out throughout the whole abdomen. Okay. And this person dies almost instantly because they lose like a whole lot of blood in seconds. So even if they had a cardiothoracic surgeon standing over them, they'd probably die because it's just massive blood loss instantly. Okay.
Mm.
So now, who is the patient who gets all of this? Who's the patient who's likely to have any of this? Primarily elderly compared to young. It can happen at any age, but it typically happens with people who are older. Male, female, it could happen. It tends to happen to more males, but it could be equal. But somebody with chronic hypertension. Poorly controlled hypertension is the biggest cause of this. Smoking. Okay, because smoking constricts the blood vessels. And when you constrict the blood vessels, that increases the resistance. And when you increase the resistance, that increases the pressure. Okay, so smoking leads to hypertension. Hypertension leads to all of these things. All right, so give me that again, Billy. Man, you get your own little private session today. Okay, so let's go over these aortic problems again.
So like an aneurysm is when you have an occlusion and from old blood and backing up and forms like a clot.
Mm-hmm. And I don't want you to say occlusion primarily. I just want you to say a bulging.
Okay.
Okay, so it's where you have this bulge. And what happens, the reason it bulges out first, I mean, yes, you can have an occlusion, but that's not the first problem. The first problem is there's high pressure in the wall, because remember, they have high blood pressure, and that extra pressure starts pushing on the wall and pushing it out. But when you now push on the wall, what it does is it thins the wall. Now the wall gets thinner because there's constant pressure on it. And as that wall gets thinner, it gets weaker. And as the wall gets weaker, now it's more likely to, the layers are likely to just dissect. And when you have the dissection, that's where blood now leaks out from the tunica intima and leaks into other layers. And then if you keep having more pressure, the pipes just burst. And now you have an aortic rupture. All right, give me that again.
So you get like a bulge in the aorta from old blood, and
not from old blood. No. Oh, let's do it this way. The first thing that happens is you have an increase in pressure, and that pressure leads to a bulge. Now, something else that can happen is now blood can accumulate in that bulge, and that blood can now lead to a clot.
Okay.
But the first thing that happens, okay, so let's do it this way. The first thing that happens is you have the pressure that leads to the bulge.
Okay.
But then once you have this pocket, now blood can start accumulating in that pocket, and that blood can now form a clot.
Okay.
Okay. Tell me, what's the starting point though?
So high pressure in the aorta can form a bulge.
Yes.
And then which
pushes
can
it out.
accumulate old blood, but which pushes it out, forms the bulge.
Yes.
And then it can lead to a dissection from the tunica intima into the media.
Okay.
When the blood starts to leak out, which can eventually form into a rupture where it comes completely out of the aorta.
Okay. Now, in an aortic dissection, what's going to happen? If blood is starting to leak out other places, what happens to the blood pressure?
It's going to drop.
Right. Because it has to be inside the aorta for your body to measure it as blood pressure. And if it's now leaking out of the aorta, your blood pressure drops. So this is why, for instance, on one side versus the other side, and one arm versus the other arm, you may have a difference in the systolic blood pressure.
Mm-hmm.
Okay. How does this patient present though? So they probably look shocky. They probably are hypotensive. or at least they're hypotensive in one arm compared to the other, depending on which side it's on.
All right.
And so they're probably going to have some kind of perfusion problem. Everything is oxygenation, ventilation, perfusion, right? So they're probably going to have a perfusion problem, probably signs of shock, and then they have pain radiating where?
It's chest radiating to the back.
Yeah, so this is going to be a tearing sensation with radiation to the back. Okay?
Right.
And then the rupture, they're likely to be dead. Okay? Because, I mean, there's like, if they have a rupture, there's almost nothing. They're almost 100% fatal.
So is the bulge from the aneurysm is what you would feel sometimes if you feel like the pulsating mass in their stomach?
You could, yes.
Okay.
Especially as it gets larger. Like if it's, let's say if it's only like 2 centimeters, you may not notice anything. As it gets greater than 5 centimeters, yes, you may have what's described as a pulsatile mass.
Okay.
Okay. Is this helping?
Yeah.
Okay.
Yeah.
Let's see.
This is definitely a great refresher, especially all that abdominal stuff.
Okay.
I enjoyed that.
And I'm telling you, drawing these, I mean, you obviously see me draw pictures constantly, right? But I don't just do it to impress you with what I can do. I do it to give you an example of what you should do.
Mm-hmm.
So constantly draw these pictures. Like I can figure out so much from just a picture more than I can just reading a PowerPoint slide.
Yeah.
What else? What else?